Hip arthroscopy. Introduction. The head of the femur or thigh bone has the shape of a ball that fits in a socket in the pelvis. Select true or false. Correct. The socket is formed by part of the pelvis bone. The ball is the upper end of the femur. Hip joint damage can be caused by an injury. Select true or false. Correct. Hip joint damage can be caused by FAI, dysplasia, infection, or other disorders and injuries. You should tell your healthcare provider about any medication that you take. Select true or false. Correct. Be sure to tell your healthcare provider about any medications or supplements that you take. You may need to stop taking them before surgery. Your leg will be in traction during hip arthroscopy. Select true or false. Correct. Your hip will be gently pulled away from the socket so that your healthcare provider can insert instruments, view the joint, and perform treatments. Are infections common after surgery? Select yes or no. Correct. Infections are rare, but they may happen. Bleeding and scarring may also happen. Is hip arthroscopy always successful? Select yes or no. Correct. Hip arthroscopy may not be successful. Sometimes damage may be too severe to be reversed. You will need to use crutches or a walker while you recover. Select true or false. Correct. You should not place any weight on the side of your body that had surgery for a week. Thank you for using Explain.